Good afternoon. Welcome to the Labor Forum. You are tuned in to WRFG here in a very sunny Atlanta day. We are 89.3 FM. The program, as you know, for those of you who listen all the time, besides being available on your radio, you also can tune into us on your computer at www.wrfg.org. We also have a mobile app so that you can take us anywhere in the world, anywhere you are. And for those of you who are interested in watching live radio, you can watch this broadcast actually on the Labor Forum YouTube channel. It is being streamed live now, but if you're interested in seeing our guests and seeing how radio works at community radio, you can go to the Labor Forum YouTube channel and you'll be able to see the program later, any old time you'll choose. The opinions that are expressed on this program, though, are not necessarily those of the Board of Directors, staff, or volunteers here at WRFG. My name is Diane Mathowitz, and I've been the host of this program for several years now. I always want to make sure that we acknowledge the tremendous work of Gary Washington, who started this program back in 1986. Gary is a Teamster steward, and he really made it for sure that the voices of working people would always have a place on the dial here at WRFG. I am a retired auto worker. I worked for 30 years for General Motors, and I am one of those people they call a longtime community activist. As the years keep rolling along, the long keeps getting longer. I do want to make sure that there is no doubt in your mind that WRFG and the Labor Forum actively solicits and encourages you to contribute to the well-being of this station. As we so proudly say, we are not bound by any music label to play certain records or music. We are not enforced by any corporation to take any position. We are a community radio station. We endeavor very hard, all of us who are volunteers here, to reflect the various interests and needs of this community and to uplift our community. So we're not interested in the tawdry kind of news, the inflammatory kind of rhetoric that is the way it is on most commercial radio stations and newspapers and television that are all trying to drive their ratings up based on, really things that don't really improve the community. So my co-host Paul McLennan is not here today, so you're going to hear my voice for two of the opening segments. And we have two guests in the studio, both of them who are home health care workers. They are now on the cutting edge of the fight for $15 an hour and a union. And we will be talking with them for the remainder of the program after I finish reading the labor headlines for today and the labor history segment. So we'll get right at it. And I want to remind you that you, of course, can make your pledge online at wrfg.org. You always can call into the studio at 404-523-8989 any time of the day or night. And the other advantage, you want to come meet us, you can come walk your money in at 1083 Austin Avenue, Northeast in the Little Five Points Community Center. So here are the labor headlines for Monday, October 20th. We'll start first with the massive marches and strikes in Britain this past week by public sector workers, such as teachers, nurses, and other healthcare workers, postal and rail employees, and civil servants in general. For the last 4 years, these workers have been under a government-mandated pay freeze, resulting in at least a 20% reduction in their income. They were offered a less than 1% increase, a proposal that brought tens of thousands into the streets of London, Glasgow, and Belfast on this past Saturday, October 18th. 90,000 alone marched in London in a coordinated protest entitled "Britain Needs a Pay Raise." The Saturday protest marches were preceded by large demonstrations and job actions by thousands of healthcare workers on Monday, October 13th, and civil servants on Wednesday, October 15th. So obviously the fight against austerity and the continued tax breaks and favorite treatment that's given to wealthy people and corporations is not just something here in the United States, but also is being faced by our brothers and sisters in Britain. Now for national news. On Friday, October 17th, a federal bankruptcy judge, Kevin Gross, and this is a gross report, I have to tell you all, voided the union contract of 1,100 workers, members of Unite Here, Local 54, employed at the Trump Taj Mahal Casino Resort in Atlantic City, New Jersey. The workers, whose average wage is $12.50 an hour, will lose an estimated $15 million in health insurance and pension benefits as a result of their contract being just thrown out the window. The billionaire investor Carl Icahn, and if there were other workers here, we'd all hear a big boo. Carl Icahn holds $286 million of the casino's debt, and he is the driving force in the attack on the workers' benefits and pay. Now, mind you, this is a billionaire. His reputation as a corporate raider began with the hostile takeover of TWA in 1985, when he stripped the globally known airline of its assets, lining his own pockets with $469 million in personal profit, while driving the company into massive debt. By 2001, TWA had filed for bankruptcy for a third time and was acquired by American Airlines. This whole deregulation of the airline industry has resulted in literally thousands of workers losing their jobs, their pensions, and their benefits. The casino owners are pressing for massive state aid in the tune of hundreds of millions of dollars in tax breaks and other giveaways. 3 other casinos have closed in September, affecting the jobs of 5,240 people. The tourist economy of Atlantic City was devastated by Hurricane Sandy and the general impact of the recession, and of course the profiteering of the owners. This past Saturday, Savannah Teamster members employed by First Student as bus drivers and mechanics authorized a strike as negotiations with the company continue. The issue at hand is a worker proposal that the corporation add an hour of pay for each day worked during the school year to be paid out during the summer break. This innovative idea is to counter the loss of unemployment benefits to school workers employed by subcontracted companies such as First Student and Sodexo, and there are others. But First Student transports some 25,000 children to Savannah Public Schools. In a harsh anti-worker move this past legislative session, House Bill 714 was passed by Georgia lawmakers that stripped cafeteria workers, crossing guards, bus drivers, and other school workers who work for companies, as I mentioned, like Sodexo and First Student, from applying for and receiving unemployment benefits during holiday and summer breaks, despite the fact that these companies pay into the Unemployment Compensation Fund. This reactionary law was in response to a successful campaign that restored a similar ban instituted unilaterally by Labor Commissioner Mark Butler in 2012. Teamsters Local 728, Jobs with Justice, and many other community groups and unions fought back, and in 2013, Georgia was forced to repay some $8 million in denied benefits to the school workers. Despite the efforts of these low-wage workers who have tremendous responsibility for the well-being of children, a bill denying them any income relief during the summer was rushed through the 2014 General Assembly. The Savannah workers are the first in the nation to demand this plan, which would allow them to support their families during the summer until they resume their jobs in the fall. And that's our labor headlines for today, this Monday, October 20th. As I mentioned, Paul is not here, but he has submitted this piece on labor history. So I'm going to go ahead and give you this great update that he has about an event that took place on October 19th, 1960. Several hundred students from the Atlanta University Center held mass sit-ins at lunch counters at Rich's Department Store and 7 other Atlanta department stores. 51 people were arrested. The following day, 23 people were arrested, and 36 of those arrested over those 2 days refused to pay bail as part of a jail, no bail strategy to intensify the struggle. They were charged with trespass and refusing to leave private facilities. Dr. Martin Luther King Jr. was among those arrested, and he was later transferred to Reidsville State Prison. Earlier that year, on February 1st, a wave of sit-ins was started in Greensboro, North Carolina, by students from North Carolina A&T. After reading about those sit-ins and dissatisfied with the city's slow pace of change, AUC students Lonnie King, Julian Bond, Herschelite Sullivan, Carolyn Long, Joseph Pierce, and others formed the Committee on Appeal for Human Rights. They organized workshops and training sessions on the strategy and tactics of nonviolent resistance and began recruiting students willing to take an oath of nonviolence and sit in at local lunch counters. In preparation for beginning the sit-in campaign, the committee published an appeal for human rights in Atlanta newspapers on March 9, 1960. It was a declaration of war against racism and discrimination. Citing numerous inequalities and injustices in education, housing, voting, health, employment, and law enforcement, the document challenged city officials and people of goodwill to live up to Atlanta's progressive reputation, while warning that failure to do so could result in sustained protest. And this is a quote: "We pledge our unqualified support to those students in this nation who have recently been engaged in the significant movement to secure certain long-awaited rights and privileges," the appeal said. "We do not intend to wait placidly for those which are already legally and morally ours to be meted out to us one at a time. Today's youth will not sit by submissively while being denied all the rights, privileges, and joys of life. We want to state clearly and unequivocally that we cannot tolerate in a nation professing democracy, and among people professing democracy, and among people professing Christianity, the discriminatory conditions under which the Negro is living today in Atlanta, Georgia, supposedly one of the most progressive cities in the South." Close quote. On March 15th, the committee launched its direct action campaign. 200 students participated in sit-ins in 10 different locations downtown, including the State Capitol Building, the County Courthouse, City Hall, bus stations, and railway stations. Governor Ernest Vandiver ordered arrests, which resulted in 77 students going to jail. Then, on April 15th to the 17th, 1960, at Shaw University in Raleigh, North Carolina, the Student Nonviolent Coordinating Committee, known popularly as SNCC, was established by young people who had emerged as leaders of the sit-in protest movement. Under the guidance of the Southern Christian Leadership Conference Executive Director, Ella Baker, the organization provided a way to harness the energy and commitment of black youth to the liberation struggle. The students remained fiercely independent of any other civil rights organization and generated their own projects and strategies. In Atlanta, it was America too, but in Atlanta, the business community showed no signs of willingness to negotiate that spring of 1960. So it was decided to resume the sit-in campaign in the fall. The students waited in order to coincide with the presidential election because they hoped to gain national attention and help make civil rights a subject of national debate. As was expected, the sight of nonviolent black protesters being jeered by crowds of hostile whites flew in the face of Mayor Hartsfield's carefully crafted image of Atlanta as, quote, "the city too busy to hate," close quote. The city's business community continued to remain opposed to desegregation, and some key business leaders refused to negotiate altogether. The Committee on Appeal for Human Rights called for a wider boycott of downtown businesses to bankrupt this economy of segregation. As a result, protests forced the closure of all downtown lunch counters by the end of November. A Christmas season of significant financial loss for white merchants because of a boycott by the black community demonstrated the economic clout of African Americans in the city. While the protests continued into the early months of 1961, white business leaders met privately with their counterparts in the city's black establishment to negotiate a settlement to the desegregation stalemate. On March 7, 1961, student leaders were summoned to a downtown meeting where they learned that the city's white and black leaders had brokered a deal to desegregate the city's lunch counters. Under the arrangement, desegregation would occur the following fall, following the court-ordered integration of local schools. Although they objected to the delay and felt betrayed by their elders, the students ultimately consented to the settlement. Segregation continued throughout Atlanta and led to additional sit-ins throughout 1963. Many restaurants and lunch counters remained segregated until the passage of the Civil Rights Act of 1964 outlawed the practice. African American students and youth led the struggle to desegregate Atlanta. To do this, they had to challenge the established leadership within the black community and their traditional reliance on legislation and litigation. The sit-in protests are another historic example of how the courage and creativity of youth can spark movements for transformative change and liberation. And that's our This Week in Labor History, written by Paul McLennan, Amalgamated Transit Workers Union, co-host of the Labor Forum. All right, so I've talked a lot. And so we are going to move into our interviews section of the program. Again, I want to remind all of you listening, whichever way you are, that the station really relies on you, the listener, to make sure that we are able to stay on air. It's been a phenomenal feat of being an all-volunteer station sponsored by listeners for 41 years. I'm not even too sure if there are any other stations like this in the whole country. So because of that, it is really important that however much you can contribute, you please do. And as I mentioned, you can go online and do it with your credit card or debit card at wrfg.org. You can mail a check to 1083 Austin Avenue, Northeast, and that zip is 30307. And you can call in anytime, 24/7, and speak to whoever is here on air and make your pledge at 404-523-8989. And I have to say, I am really thrilled to have these two guests in the studio because the Labor Forum has really tried to highlight the voices, the experience, and more importantly, the solutions to the economic doldrums, and it's not even doldrums, the economic misery of so many tens of millions of workers here in the United States. This country, which has really money apparently pouring out everywhere when it comes to war, tax breaks for the rich, and extravagant, unneeded, and unnecessary projects, which just benefit a few. But when it comes to the issues that all of the people need, which is decent jobs, healthcare, education, transportation, and an ability and an opportunity to participate in culture, music, art, sports. That's where we see that the priorities and the interests of those that rule this country seem to diverge greatly from us. So in the studio we have two sisters who are here, Salitha Durham. Hi, Salitha.
Hi, how are you?
I'm great. As I said, I'm really excited that you are here. And then Marie. I knew it. I'm looking right at how she's telling me to say her name. Umdamu.
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 Cool. What's the origin of your last name?
It actually comes from East Africa, Tanzania. My husband lovingly gave me that last name.
Okay, Umdamu. Well, my last name is Mathewitz. But it's not quite the same, but nobody ever can figure out how to say it either. Both of these women are active in the struggle for $15 an hour and a union, critical point, not just more pay, but a right to a voice on a job and make a determination of the conditions under which you work, and they are home health care workers. So I will start off first by asking Salitha if you wouldn't mind telling me what home healthcare workers do.
Well, home healthcare workers, they assist patients with their ADLs that consist of.
Okay, now you know that nobody knows what ADL means.
Okay. Activities of daily living, things that people need daily to keep their life going. Bathing, feeding, maybe transporting to the doctor, just.
Giving them medications on time.
Yeah, medications, dressing them. It's things that people can't do on their own. We assist them with their,
Daily living.
daily living. Yes.
All right, so let me ask you again, how long have you been doing this?
Well, I've been doing home health care for 13 years, but I've been certified as a nursing assistant for 23 years.
Okay, now I'm going to go ahead and ask Marie. All right, so one of the things that I have read in the newspaper, and as a person who now is on Social Security myself, they talk about this baby boomer generation and about how this field of work is probably going to be one of the ones that expand the most as more and more of us, this huge chunk of the population, get older and need exactly what Salitha just said, is that we're going to need help.
Yes.
So, can you talk a little bit about how many, if there's any way you know, how many home health care workers are maybe in the metro area? I mean, what kind of and then who is it who are home health care workers?
Well, I really wouldn't know the exact numbers. I would say this, that we also have people who have their children still at home that are caring for their disabled children. We have parents that are getting older and their children are also taking care of them. There are workers that are working for agencies that are going out and they're caring for people in nursing homes, hospitals, in their homes. I mean, it's really one of those things where it's broad and it's spread around, I mean, the nation. It's not just here in Atlanta, Georgia. It's one of those things where if a family member is in need of some kind of care, maybe they've had an accident and now they require that care. Now, some form of family member, or if they're not paying for it to come in, they're doing it themselves. So we have home health care workers across the board, not just in Atlanta. It's pretty much across the nation.
Mm-hmm. Mm-hmm. So who are the most of the home health care workers? I am guessing, just because the healthcare field is so dominated by women in general, that's the case. But how is it that people get into home health care? And if you do know any kind of percentages about how many are women, people of color, immigrants, et cetera, et cetera.
I can say on a personal note, I can't speak for everybody across the board, but I remember growing up, my grandparents worked in an agency and they were taking care of people then. I was only a small child and I remember them having to leave for work and go to a facility of some sort. I didn't remember her ever having to visit a home, but I do remember her going to local agencies. Sometimes if a hospital needs somebody, they'll go through an agency. They were doing that back then when I was a young child. I actually think that I got into it because seeing that growing up, that made it something easy for me to want to get into because I saw the care. I saw when people were in need of help that my parents or my grandparents were reaching out to help someone else. And I think that is something that kind of grew onto me as a child. And I said, well, when I grow up, I think I want to do something to where I can give of myself and care for people. And that's pretty much what I've done.
Salitha, can I ask you, all right, I don't want to get super into your business, but I do want to know about what kind of wages, benefits, how many hours, all those kinds of things that home health care workers, because it seems to me there's probably a difference between maybe pay and conditions between those who work for an agency and those that sort of get their jobs independently. So I know that's kind of a big question, and we'll come back to that question. Just in a moment, we're gonna listen to an announcement from WRFG. So to remind you, I'm wanting to know about wages, working conditions of people who work for agencies and those that are working independently. We'll be right back, folks. And we're back here on the Labor Forum. You are tuned into WRFG 89.3 FM. And we have just started a conversation with two home health care workers here in the Metro Atlanta area, Salitha and Marie, who are going to talk to us about their experience. I just want to underline or underscore what an absolutely critical job this is. One of the things that often happens here on the Labor Forum is we bring in people who if they didn't do their work, it's even hard to imagine how dysfunctional society would be. And that's everybody from sanitation workers, teachers, and healthcare workers, and fast food workers, and all the others. And yet, the way things are set up, they often have the lowest pay and the least respect. So before we went on the break, and I hope everybody comes to our fundraiser on the 26th, it's going to be great. I had asked a question of both Salitha and Marie to describe the differences between what it means to be a home health care worker who works for an agency or one who perhaps gets their jobs independently, and whether there is much difference in wages and benefits. So I'll ask that for Salitha first.
Well, when a home health care worker works through an agency, the agency takes actually half of the pay, well, the majority of the pay. And we are left with, I guess, the lowest end of the pay. And most of the agencies, they would tell you that they only have part-time work. So when they hire you part-time, that means you do not have health benefits, no paid vacations, no paid sick leave. So it's, kind of devastating. But if you're working independently, you still have to go and get your own health insurance, and you probably need liability insurance, to protect you from, if a patient gets hurt and things. So that's money still coming out of your pocket that has to go toward other things. So that's the difference between working through an agency and working independently.
Okay, so there's a lot of these temporary job agencies. Most of them are pretty despicable. I think what happens oftentimes, though, is that people, have a hard time getting through to jobs, to get a job, and so they are often forced into this. You said, Salitha, that it's half or less.
Well,
So what does that end up being that a worker would perhaps average get for doing this incredible work?
Well, for instance, if an agency, say their hourly rate is 20 an hour, I guess they would get 10 and you would get 10. So they get half and give you the other half. That's basically it. Or
So basically you're paying them $10 an hour for them to have helped gotten you the job, but everything else still falls on you because there's no benefits.
Yes, no benefits, no health insurance, no paid sick leave, no paid vacations. So basically you're just, I guess, working for the agency, yeah.
All right, so let me ask you a question. So how when you are an independent home healthcare worker, how is it that you get the job? Because this also strikes me as, again, a very unequal situation where I would imagine it's pretty hard to ask an employer for a real living wage because they also know they've got the power to pay you very little, and they know what the going rate is at these agencies. Do either of you have an experience with how you work to get a job with an independent, as an independent person?
I have worked in a facility long time ago where we were sent to different places, like say a hospital, or it could be a nursing facility or a patient's home. When those patients get to know you, and they decide, oh, you're a really good worker, we'd like to keep you on here, something like that, then that's something that's worked out with the person who's actually paying and yourself outside of actually working through the agency. And that's how you come into being able to take care of people independently. Even if you're still working for the agency, they might decide to leave that agency. Maybe they don't like the way things stand with the agency and they would rather just have one home health care worker come in instead of several, and then they offer a different pay rate or what have you, and that's how you find yourself being an independent.
All right, let's get to this other question though, which is the two of you are leaders in this fight to get home health care workers at least a minimum wage of $15 an hour, and more importantly, the right to join a union and have a union contract and have certain things that come with your job. So would both of you talk about how it is you personally came to decide that this is something you were going to give energy and time to, and that you're willing to, really fight?
Well, I decided to fight for the $15 an hour because we as home health care workers, we give quality care to our patients, every day. And we have an important job. Like if something happens to our patient, we actually have to save their lives. So we're doing important work, good quality work, and I think we deserve to be appreciated and through our wages, and that's basically it. So I joined the fight to help us to get a union and better pay for our home health care workers.
Same question to you, Marie.
Okay, for myself, I would have to say I decided to join this fight because I've been in this business basically for 25 years of my life, and I'm still making the same wages I made back in 1989. What I wanted to do when I heard about this fight was make a difference, because I know that I make the difference when I come into a person's home. When they see me and I care for them, I care about their environment that they're living in. I also provide a companion when they feel lonely. It's not just about the hands-on care, it's also about the psychological care that they have when I'm into their environment, when I'm there for them. But when I go home at the end of the day, I'm tired. I'm not having enough time with my own family. My 4-year-old is like, Mommy, can I go with you to work? Because he thinks that work is another home, that he wants to go live with Mommy at. And I think that when we're having that impact on helping other people, we should be able to spend that time with our families as well and come home and give something back to the family. The paycheck is already gone before the bill even pops up. I think the wage needs to be livable. It's not livable. What we give is a forever thing. One day we're going to be old and we don't have enough to save up for our own retirement, so that when we're old and we need the kind of care that we're giving today, there's nothing left. There's nothing. My kids will have to take care of me with their own families, and I have nothing to contribute to that. That's a problem. And we need the union because we need someone to stand behind us and back us when we're not being treated fairly. And in this case, we're not being treated fairly. And things need to change on that avenue, because not only are we living for the people we care for, we live for our families. But when our time is done here in this business doing what we do, who's going to care for us? What's left? My retirement fund holds $37, and that's a shame. I don't have a job to where anybody will contribute to my retirement fund, so when I'm old and gray, if I get injured or need that home care, I can't get that care for myself. And that's why I'm in this fight, because I know I'm not the only one. I know there's other people who are struggling paycheck to paycheck just to try and make it, and they're barely making it. A rob Peter to pay Paul situation, and that situation needs to change.
Well, let me ask both of you, because I'm wondering how you actually found out about it. So is the way that you're reaching out to other home health care workers, what are the methods you're using? Is it because your friends are also home health care workers, or you know people in your community, or in your church, or how are you recruiting, adding to your ranks?
I would have to say, for me, it was Facebook, believe it or not.
Okay, Facebook.
I'm on Facebook every day, and a question came to me that how would I like to make $15 an hour as a home care worker? And even though I scroll through that Facebook page, that really stuck out at me, because who wouldn't want to make $15 an hour doing what we do, and we get so little? Sometimes it's between the minimum wage and maybe $9, maybe $10, and we're still struggling. So I answered that question. I would love to make $15 an hour, and I would love to have a union. And when I answered that, one of the workers actually came to my home, and she sat down with me, and we talked, and I let her know how I felt. I was very avid on wanting to join this fight, and that's the way I found out, and that's also the avenue I use to pass it on to others. All the home care workers that I know, I talk to them, I pass flyers, I do it on my internet page. However I have to get it out, that's how I get it out.
How did you find out, Saliva?
That's basically how I found out too, on Facebook. I fill out the information, and I'm telling other home care workers about the fight, and people in the community, and people are really supporting us. They feel like that we do deserve more money, need more money, so people are really supporting us in the community.
Okay, so what is this Facebook page?
Facebook is actually a social network.
No, I mean, what is the address of the page that you all, or how did you find it?
I was just strolling down Facebook, and I saw the article that said, do you think that home care workers deserve better pay than $15 an hour? And I mashed the button and filled in my information, and someone came out to my home and talked to me.
Well,
But
basically the way it's set up is
Yeah.
they have two avenues: your own page,
Yes.
and then they have a general page
and it was on the
where
agenda.
other people come in, or other agencies or whatever come in, and they put their advertisements or whatever. I was checking the general page,
Yes.
and once I answered that question, well, if you like it, it gets added onto your page, and then everything that comes on from those people after that automatically goes to your page from then forth.
All right, so let me ask this question. Now, how long is this? I know that this campaign is national, because here on the Labor Forum, after the Minnesota home health care workers successfully won their union vote in Minnesota, covers the whole state. We had a sister on by the name of Summer, who talked about it. So I would imagine that when home health care workers around the country saw that news, that was a big incentive, a big spur, that it really showed that it could be done.
Yes.
So if you wouldn't mind talking to what you know about where else it's happening in the United States, and kind of what's going on with home health care workers, not just in Metro Atlanta, but around the country.
I know that the fight is continuing on in states like Ohio, Michigan, Washington, Massachusetts, and of course we can't leave out Georgia. We've been trying to get together because we feel if we back each other, not just in our own state, but everywhere. We've been going to visiting states also, backing them in their fight, that the more numbers that we draw together, the more we're able to get this thing done.
So let me ask, there was some legislation, and I think California, maybe New York State too, that referenced another kind of domestic home worker, which was nannies and maids and cooks, and some of them are healthcare workers too. Is there an impact between this legislation? Because people should know that this whole category of workers are not included under the National Labor Relations Act. So farm workers, home workers are some of these huge numbers of workers that essentially there's no legislation that allows them a union vote. There's no, any of the labor laws really don't apply. So how is it that you're going to try to approach this here in Georgia? Here we are, right to work state. Oh my gosh. Just kind of one of the worst places in general for workers who are trying to better themselves. If you wouldn't mind talking about exactly, I mean, obviously the first thing is to get thousands and thousands of healthcare workers and get your support together, but is there a national strategy that's being used, or is every state different?
Well, we've been trying to reach out first to those home health care workers that we know. And with that, they reach out, and we're hoping that it branches out. Starting with one person, you can build many if the branch continues to grow. And that's the avenue for which we're really trying to approach this. We're trying to say, well, if we get 3 people and that 3 people get 3 more people, and it goes on and goes on, that's how we're going to do this. And we're doing this by knocking on doors. We're doing this by going on our internet page. We're doing this by phone call. We're doing this, it's just if we see people coming out of a healthcare facility and we know that and we ask them the question, how would you like to make $15 an hour? How would you like to have a union? And word of mouth, it just spreads that way. And we're hoping that this is going to be the avenue that's going to bring us the numbers. Once those numbers are brought together, then we want to address politicians, and hopefully it spreads out. We're using this avenue, the radio. This is the kind of thing, people listen. We know that they hear us, and we know that if they want the same thing, they're going to spread that news, and it's going to keep on spreading.
So let me ask both of you, I think I met some of the home health care workers that are engaged in this fight at a fast food worker demonstration. So very similar. We see this really, I would describe it as an earthquake from below, coming up from people who have been both overlooked, made seem to be invisible, provide services, get paid terribly bad wages, are treated with disrespect, and yet that's the group that really, this is a program that talks about unions and workers' struggles, and there might be some who think, you know, it's higher paid workers who will make the difference. And I'd have to say that what we're looking at right now with really the vast majority of people considered low wage workers, that this is where it's at. So you all have just changed history. There's just no other way to put it, and you will change history. But talk to me about this alliance between other segments, because many fast food workers work for big corporate chains, you know, that make billions in profits. And so there may be differences in some strategy, but how is it that you all are working together?
Well, there is power in numbers if, people, if we get together as, people, and the politicians see that we are serious about this fight, and we put the politicians in that support raising higher wages, we believe that we can get the job done.
And I think a lot of people have a misunderstanding of how much a fast food worker or a home healthcare worker makes. I think when they see a scrub uniform, they think that we must get paid a decent wage, and we don't. It's a misinterpretation. When we saw a nurse back in the 70s or the 80s, we knew they were a nurse. They had the little hats on, and we knew they worked directly up under the doctors, so they had to make a good wage. Well, CNAs and health workers and things like that, they usually come in directly under a nurse, and a lot of people misinterpret that maybe they make a good wage. They work for maybe a senior living center or independent living health care or even a hospital. And with that, they think that the wage it must be something that is livable. But I'm here to tell you, it's not. Most of the healthcare workers are making in between the minimum wage, $7.35 and $9, and we need to let people know that this is not the case. We're not earning a decent wage. We're barely getting by. Some of us, most of us, have more than just this job doing the home health care. We're doing fast food on the side, or we're watching children, or we're doing something else to try to compensate for the wage, but yet we still fall below the poverty level. They need to know that we're not working we're not making what they think we are. And I think a lot of people will stand up and say, what? They're doing all this work. We're doing the cooking, we're doing the cleaning, we're doing the companionship, we're putting them to bed, we're bathing, and we're changing them. But all we get is $7, $9 an hour, and that's what we're supposed to go away with. There's nothing left to save up for ourselves, or we don't spend any time at home with our own, and they think, oh, they must make a good living, but it's really hard. We're not making it. We're barely getting by, and I think the public needs to know that if they don't know.
I think it's just one more sort of follow-up question. I think one of the issues that you mentioned is of no benefits, so no health care yourself, no vacation ever. You have to work
Sick pay,
all the
none
time.
of that.
And then I want to know on this sick pay, so that really seems to me to be a kind of a ridiculous thing, because if you're caring for healthy, people who have fragile health, and yet you
Can't take care of ourselves.
and then do you come in? It's
Take
an
off.
issue like with fast food workers too, or any restaurant workers, where to lose that little pay means that oftentimes people come in when they're not feeling well, and that's not a good thing for them or the public.
If we stay at
So-
home, we don't get paid for it, so.
And most of us on public assistance, it mainly covers the children, but the adults in the home, they don't get that. And so if, like myself, I'm over 40 years old and I need a yearly annual checkup, I can't get that, because the cost of that would go into my child's food, or it wouldn't allow me to pay the rent the way I need to, or the car insurance that we need. Nothing is there to say, okay, I need to take care of me now. I need to have my annual checkups. There's nothing put in place for that. If the place of employment doesn't offer health insurance, even if they did, could we afford it on the wages that they pay? No, we can't. We can't afford it.
All right, so I think that the two of you have presented ample reasons why not just everybody out there who is a low-wage worker needs to take inspiration from the absolute passion and determination the two of you talk. When you talk, it's just comes out that you are determined to win what should be not just yours, but really every worker's right, which is a living wage and decent health care, a vacation. The idea that people in this
And
country
we don't think that's
don't
too
have-
much to ask.
No.
don't have vacations. So I want to, in these last couple minutes of this interview, first thank you both so much for
Thank
coming
you for
in.
having us.
Thank
And I
you.
want to have you back many more times. But I want to give you an opportunity to let our listeners and viewers know if they are home health care workers, know a home health care worker, or just are in general interested in the fight for $15 an hour and a union. How do they reach you all?
Well, we actually have a website here. We also have a phone number that you can call. The website is www.fightfor15homecare.org/ATL, and the phone number is 404-630-0420.
Marie, do that one more time. A lot of folks are out driving, all right, so I don't want you to be trying to write something down, but there might also be a way to just, search for it. So do that as well, but go ahead and give all of those numbers and words again.
Okay, if you're out there and you're listening, Radio World, if you're interested in more information, you can visit us at www.fightfor15homecare.org/ATL, or you can call us at 404-630-0420 and pass that on.
All right, so super information. I want to ask both of you just one more time to, in just a couple of minutes, pretend now that I'm a home health care worker and I'm standing at the bus stop, and you got just a couple minutes to say something to me that'll make me change my life.
Well, what worked for me was, how would you like to make $15 an hour? But we also have little flyers that we pass out to those, because most of the information is on that, including the website and the phone number.
I want to say that, you know, I think that the two of you would be both great representatives of this. But how would you counter, and the reason I asked you that kind of pretend question, is that a lot of people, I don't know if they've lost hope in changing things, because it just sort of seems to many people that one, things never change, or if they do, they get worse. So, you know, you really have to dig deep into yourself as a person to stand up for your own rights.
Yes, you do.
And you really have to say, I don't, you know, nobody deserves to be treated the way I'm being treated.
Nobody.
So, okay, Salitha, so here I am sitting at the bus corner, and you don't know me. How are you gonna make me understand the value that I have?
Okay. I would tell you, if you want to change things, to get out and, you know, help us to, you know, pass out cards, support our cause, get out and vote for like politicians that are willing to, you know, raise the minimum wage. And I would just say, get out. Nothing doesn't, if you don't do anything, you know, nothing would change. But if you really believe in yourself and believe that things will happen, you will get out and support us. And you know, the more support that we have, the better. And things will get better if, you know, you just
And you
yeah,
talk to
support
who
us.
you know, and you talk to who you don't know, because a lot of people that you know a lot of people that you don't know. And that's how it spreads around. I think what we have to do here is we have to stick together. As the numbers build up and we start to come together, we're going to see the changes that we're looking for. We need those changes. It's definitely not an option for us to keep continuing on this way, because one of these days we're going to need that healthcare worker at our home, you know. And a lot of people know this because they're going through this. And I say to those who have home care workers in your homes, please know that they're struggling sometimes and they may need a higher wage. And that is what we're fighting for here. We're fighting for the people who are at your home right now that are not at home with their husbands or their children or their families. They're at your home to care for your loved ones. They're at your home to care for you. Whatever the needs are in your home, that's what they're there to provide. But they need your help to stand up for them and say, okay, this home care worker does this for me. We need to see a change, and also join in their fight. Thanks.
So that's the key here at WRFG's Labor Forum, and that is solidarity. When the song starts out at the beginning, we mentioned so many different kinds of work that people do. And the thing that we have all in common is, of course, that we are the ones that make the difference for society as a whole. It doesn't matter what kind of job we have. Every one of our jobs is important. And that is how we will end today. Thanking again Salitha and Marie for being here.
Thank you very much.
And
Thank you.
it was
Thank you
a
for having
super opportunity for people to actually hear from you the absolute determination you have that you will improve not just your life, but those of other workers as well. Thanks so
Thank
much.
you.
Thank you.
All right, so Labor Forum listeners, do please tune in again next Monday. But before you do that next Monday, make sure you call or go online and pledge your support to WRFG. And you have you can actually note that the money should come to the Labor Forum. It doesn't really come to me or the Labor Forum, but it makes it clear that you appreciate this program. I want to thank Christopher on the board, our engineer, Ozzy Ibrahimi, who is videoing so that you can see this on the Labor Forum YouTube channel. This is Diane Mathewitz saying bye. I hope Paul is back next week and is feeling great. And again, hello to Gary Washington and to all those who have ever been on the Labor Forum and brought the news of working people. Bye-bye.